everyone, I'm Shuichi FUKUNAGA, a Japanese orthodontic doctor running a private clinic in OMIYA, Saitama City, Saitama Prefecture. I specialize in occlusion, orthodontic, and oral and maxillofacial surgery. I have worked at the oral and maxillofacial surgery department of a major hospital in Saitama for more than 30 years. I headed the department before I started my private practice. It was during my stint at the hospital that I specialized in occlusion and orthodontics for 15 years. Various researches suggest that 9 out of 10 people originally have any of the four types of bad occlusion or teeth contact, but they are usually unaware of them. In addition, you might have never seen any evidence showing your occlusion to be an ideal one. There is a possibility your occlusion was determined based only on your own gut feeling and good alignment of front teeth. But you may not be aware of the several types of bad occlusion. I have a question for you. Do you have good occlusion or teeth contact? If you would say yes, what is your proof? Is it because you don't feel anything strange or difficult when chewing? Or did your dentist show you any evidence from an examination after your treatment? If you've undergone orthodontic treatment, what you are shown as evidence of having good occlusion is so important because there are cases where orthodontic treatment in dental practice caused the patient's teeth and jaw joint to get damaged easily. In my long experience, I usually show my patient the evidence that their occlusion is ideal. I'll introduce a video of me showing a patient the evidence of good occlusion through a treatment of jaw joint disorder. In this video, I will also introduce the two types of bad occlusion. 1. Not all teeth are in contact at the same time. 2. When grinding, molar teeth hit each other. In the four types of them that you are usually unaware of, these bad occlusion lead to tooth loss and jaw joint disorder. Let's check it. This mock was set for diagnosing and treating jaw joint disorder of a female patient in her 20s. Her main complaint was that she couldn't open her mouth widely. I will show you the cause. Together, let's look at her tooth contact. Here, two molar teeth are heavily colored, showing that their contact is more distinctive than those of surrounding teeth. These teeth are protruding and they become like the fulcrum of seesaw. I will show you what is going on with her teeth contact. When she closes her mouth, these two teeth contact first, and then the lower jaw shifts. After that, all teeth then makes contact. When protruding teeth become like a seesaw fulcrum, notice these parts are like our jaw joint. What will occur on these parts of TMJ? Look at these parts. You can see a seesaw movement like this.
ガチャガチャガチャガチャいうの
Why
ですね
does a seesaw
こ
movement
ういう動き
occur?
が、起こって
You
きます
already
これ
know
はどう
the
してこういう動き
rhythm
が起こってくるかと言いま
because
すと
there are two protruding teeth acting like a seesaw fulcrum, and there are these teeth still not making contact. So when eating, her jaw joint
ですの
always
で
shakes,
こういうガチャガチ
which
ャまっ
leads
すぐ噛んだ
to
時
TMJ
こうガチャガチャ
disorder.
まあ言ってるわけなんですけども
I'd like to mention another important thing. Not only when we are eating, but also when we are grinding our teeth during sleep, that the jaw joint shouldn't be shaken because of this seesaw movement. When her lower jaw goes forward,
前に動かした時は
her
結構
jaw
安定
joint
してます
is
じゃあ
stable,
右に動
but
かした
when
時は
her
どうか
lower jaw
右
goes
に動
right,
かすとこちらの
meanwhile, her right jaw
右の
joint
関
is
節に非
shaking
常にこ
heavily.
の揺れが
Can you
出ます
see?
ね
Actually, the
まあ
left
左も
jaw
ちょっと
joint
揺れてますけ
is
ども
shaking
今度
too.
は顎を
Next,
左にこう
when
動
the
かすと
lower jaw
今度
goes
は逆に
left,
こちら側の
in this
左の
situation,
関節に
the
すごい
opposite
揺れ
left
が
jaw
生じ
joint
てい
is
ます
shaking hard.
ですからまっすぐ
Anyway,
噛
jaw
んだ
joint
時もこう
shouldn't
いう
be
揺れが起
shaken
こっちゃいけません
when
し
the lower
顎
jaw
が
moves
右
to any
左
direction,
前に動
and
いた
some
時はこ
molar
ういう
teeth
横揺
shouldn't
れが
be
起こらない方がいい
acting
わけです
like seesaw fulcrum. If the teeth acting like a seesaw fulcrum is taken for granted, this may cause gum disease that will just progress, even though you brush your teeth carefully. We saw the seesaw movement caused by a molar tooth that can lead to different problems like discomfort, soreness, and toothache, even without cavity. So what I do is to try to level the protruding molar teeth by shaving depending on the evidence from this examination. This smoke has stains because I try to level the protruding teeth by shaving on the mock first,
均等に
and
当たってます
then
から
test with the
こう揺れが
articulator
先ほどみたいに
before
ここの
I
関節の
actually
揺れが
shave the
全
patient's
く起こりません
teeth.
しっ
Now,
かり
in
ね
this
こう全部の歯
mock,
が
all the
同時に噛ん
teeth
でます
are
か
contacting all
で
at the same
ら顎
time.
が前に
The
出た
jaw
と
joint
しても
also
しっ
stopped
かり落ち着いて
shaking
ますし右に
as
動いて
compared
も
with
片付
what
けがな
I
いですし
showed
左
you
に動いても
earlier
左にちょっと
using
ね
the
あれで
mock.
すけど
After I leveled the patient's protruding
Demo,
molar teeth through shaving, I conducted an examination after the treatment because I wanted to show her the proof that she got an ideal teeth contact. So the best time to do this examination is at
でそうする
post-operation.
と
As a
し
result
っかりこ
of
う
the
関節
treatment,
に片付きが出
her
ない
tooth contact
ね
doesn't
まあ
have
調整されています
seesaw movement
右に出て
anymore,
も
and her
左
jaw
に出て
joint
も
no
こ
longer
こに
shakes.
出ても木がなくて
I
いい
usually
ですけどね
treat
まあでもほとんど大丈
TMJ
夫です
disorder this way, and
まあこの
then
よう
I
に髪型の
always
調整
show
を行う
my
ことによ
patient
って
the
顎
proof
関節
that
症を治療していくことが
they've
でき
got
ます
ideal teeth contact.
Thank you for watching the video. What I'd like to say, if that occlusion is right, examining if the hinge axis of the jaw joint shift or shake during chewing. Dentists have to check if there is a leverage or seesaw movement. When patients chew or grind their teeth with a method like this. Only this method can show evidence of good or bad occlusion. Chewing during eating and grinding the teeth during dripping are natural processes of our daily lives. So if your occlusion has leverage or seesaw movement, it gradually damages your teeth and jaw joint and lead to gum disease, tooth fracture that require extraction,
and jaw joint disorder. The more you chew and grind your teeth, the more your teeth and jaw joint will be damaged. Thank you for your kind attention.
僕は森を手にクジラを取りに行くいつも揃い